You're listening to a podcast from Cancer.net. This cancer information website is produced by the American Society of Clinical Oncology, known as ASCO, the world's leading professional organization for doctors that care for people with cancer. In today's podcast, Debra Haynes talks with Alejandro Muzio, George Donald, and Mariano Siles about meeting and working with a medical interpreter. Ms. Haynes is the Hispanic Outreach Program Coordinator for Life with Cancer, which is a part of Northern Virginia's Innova Health System. Mr. Muzio is the Language Services Manager at Innova Health System, and Mr. Donald and Mr. Siles are both medical interpreters with Innova Health System. ASCO would like to thank all four of these guests for discussing this topic.
My name is Debra Haynes, and I work with Life with Cancer and as a program outreach coordinator. And I also do interpreting, and I work with cancer patients, and so sometimes I'm also interpreting for care providers in their whole system of coming to find out about their cancer diagnosis and their treatment.
Good afternoon. My name is George Donald. I'm a staff medical interpreter at Innova Fairfax Hospital. We work as a team there, and I've been there for 5 years with Innova, all told 10 years, 10.5 years, I guess.
Hello, my name is Mariano Siles, and I work as a medical interpreter for Innova Montgomery Hospital. I've been working there for around 3 years, and I've been with the system for around 8 years.
Hi, my name is Alejandro Muzio. I'm the Language Services Manager for Innova. I'm also Innova's interpreter trainer.
Okay, we have a few questions that patients may be wanting to know the answers to. So, George, could you just tell us, when should a patient work with a medical interpreter? And is it something they will be asked that they need it, or will they have to ask for the assistance?
My first impression is that a patient should work with or ask for a medical interpreter anytime they feel like they're not sure of the information they're receiving, or anytime they feel like they need to express something they need to express. On admission, the language, requirements are asked and stated, but a lot of times it's up to the on-hand staff to reiterate the need, the right for an interpreter, or the availability of an interpreter, be it an in-person interpreter or an open-source interpreter. Sometimes that is something you have to kind of keep reminding people. Don't be in doubt. You can always ask an interpreter.
And do they have to know about costs associated with that? Is that a reason why they might not ask for an interpreter?
That hasn't been my experience that they've been concerned about the cost when they want to communicate through an interpreter. I'm not saying that thought doesn't exist, but I haven't dealt with that here.
Mariano, could you explain to us a little bit, would a patient expect to work with the same interpreter each time, or how does that work?
Well, we have different systems in place. If you go to a big hospital like Fairfax, you expect by a dispatcher, and we have 4 people throughout the day, sometimes 5, and they rotate so they get different phone calls. So you can expect to see a different person, or the same person too, it can happen. In the hospital where I work at, that is a small hospital, it's just me Monday to Friday. So we meet most of the time, or a trained bilingual staff, or they can use the phones too.
Alejandro, what should a patient expect when working with a medical interpreter? Such as what is the process of meeting a medical interpreter? What should they expect from the interpreter during a doctor's visit and other time?
Most of the time, our staff will request an interpreter, and as Mariano explained, the patient might get a different interpreter each time. But regardless of who the interpreter is, the expectations from the patient side should be pretty much the same, that the interpreter is there to assist the patient and the provider to communicate with each other as if they both spoke the same language. So basically, the role of the interpreter is to make the language barrier disappear.
Okay, and George, is there anything else that you think patients should know about working with a medical interpreter?
Well, this kind of dovetails with what Alex was talking about, that the patient should basically know that's what the interpreter is there for, that the interpreter has certain boundaries, and the role is prescribed by practice and ethics, and that puts a certain amount of limitations on the interpreter. They should know the interpreter is not going to be there to offer advice or to make suggestions, but and the interpreter might have to, the interpreter is here for this only, to interpret, to create original language and pretty much nothing else, to eliminate the barrier of language. But patients should probably be reminded, like I was saying before, that they do have a right to ask for an interpreter. They shouldn't feel like they're there without communication at all. That's something that I feel strongly about.
And what about the issue of confidentiality?
Oh, that is paramount. And when they come in, they shouldn't have to be reminded that what they say is confidential. But the interpreter is very much part of that deal, that ring of confidentiality. And whenever that needs to be mentioned, it should be mentioned. And if the interpreter has the sense that it needs to be mentioned, the interpreter can sidebar. And the interpreter would like to remind you that what you say is confidential and what you say will be completely interpreted to the best degree possible.
It is important to say that we are all trained the same. We have certain way to conduct the whole interpretation. So even though you can see different people working with these patients, it's going to be the same way of interpretation. We use the same technique. We use the same introduction. Everything very much works the same with all interpreters.
Is something else you'd like to add to that?
On the issue of confidentiality, the three of us are Spanish interpreters, and so being that the Spanish-speaking community in this area is so vast, most of the time when we find a patient who speaks Spanish, we might see them once, interpret for them once. We might never see them again at the hospital, not in the community. But confidentiality becomes particularly important for the non-Spanish languages, particularly for those who have very small communities, where patients might know the person who is the interpreter. They might know them from church, or they might know them from whatever other community activities there are. So like both George and Mariano mentioned already, every interpreter at the beginning of every session will tell the patient that everything that is shared will be kept confidential. And for some of our patients, I'm sure this is the case for the cancer patients as well, this is hugely important.
Right, it is, because they want to not have everybody know necessarily in their communities. And like you say, some of the communities are very small in the language groups. Anything else you'd like to add?
Well, he's part of HIPAA, right? So, we know about history.
Right.
So when they go to registration, we formally help them with all this information that they need to get, and that's part of HIPAA. So they know that everything needs to be kept confidential.
We do notice sometimes that there are different circles of confidentiality, even between family groups. They want, I want my husband to know about my diagnosis, about my course of treatment, why I'm here at the hospital. I don't want to tell my kids yet, and even though the often adult grown children are waiting outside, and the patient is lucid enough to say, this is what I want, this is what I want who to know, and I want the autonomy to tell them when I'm ready. And within the general idea of confidentiality, there are different circles that sometimes have to be parsed out and respected as well.
That's a really good point.
Yeah, I don't know if others have had to say that.
I think you're right, though. There are times when a patient wants only certain people to know.
Yeah, and you don't know who those are, because oftentimes in a cancer diagnosis, you would have lots of family members, and you don't know who they are,
I think that's a very good point.
Yeah.
Anything else that we can add so that patients understand what the role of an interpreter is?
Well, George talked about boundaries before, and I think something that may be important for cancer patients particularly is that the interpreter is there to support their communication with the provider. And we want the patient to speak to the provider, to look at the provider, and to receive comfort from the provider as well, if that's what's needed. And so sometimes we get complaints in our office that one of our interpreters is being cold or is being distant. And it always makes me smile, because that interpreter is actually doing what they're supposed to do, which is be as, not cold, but be as removed from session as possible, so that the patient-provider relationship can be strengthened, so the patient can receive from the provider the same service the English speaker would serve. Because as we discussed before, the next time this patient comes to see the provider, the interpreter might be different. And so building a relationship with the interpreter is not what we want. We want a good, strong relationship with the provider.
That's a paramount project for them to have good care and finish their treatment as well, and have the confidence in the provider.
A bit of continuity, too. I agree 100% what Alex has said, but many times I've been in a room interpreting for a family member and the victim is not able to communicate, or on only a slight level. And the family member will, many, many times, they have thrown themselves upon me like that. And that's not something I don't push the person away. I just, I still try to maintain, it's a difficult line to walk, maintaining your professional bearing, but not to push somebody off like that. When you go into a situation, and Alex knows and Mariano knows it, a lot of times you have to be ready for almost anything. Of course, Mariano's better looking than me, so he probably happens more to him than
Well, I think that all of you have a lot of experience doing interpreting, so you have a lot of years between you and bring a lot to the table. So I think that hopefully patients will be able to look at this and find a lot of guidance and knowing confidence that they can ask for an interpreter and they're going to get a good quality of service and that it's going to be with their best interest in mind so that they have the best provider-patient relationship possible.
Yeah.
Anything else you all would like to add that the patient should know, that we want the patients to know? We're here for them.
Basically, it's just to let them know that even though we're supposed to be invisible or, like an invisible breaker down or barriers, then we're still there. We're
part of their team.
Part of what goes on.
They're part of their team. Well, thank you very much. Anything else? Thank you very much for participating.
Thank you. More information on the role of a medical interpreter in cancer care can be found at www.cancer.net. Cancer.net is supported by the Conquer Cancer Foundation, which is working to create a world free from the fear of cancer by funding breakthrough research, sharing knowledge with physicians and patients worldwide, and supporting initiatives to ensure that all people have access to high-quality cancer care. Thank you for listening to this Cancer.net podcast.